Hello, everyone. Good afternoon, and welcome to this live session. My name is Loretta Ngwebe, and I'm really happy to have you all here today. Whether you're just joining live or you'll be watching later. So, as we approach April 4th, a time when conversations around autism are being highlighted globally, I felt it was really important for us to pause and actually talk about it in a real and practical way. Because the truth is, autism is something a lot of people have heard about, but not everyone truly understands it. And when there's a lack of non-understanding, it often leads to confusion, it leads to stigma, or even fear. And that's what we want to change. So today is really about awareness, but not just awareness in theory, awareness that helps us understand people better, support families better, and just become more compassionate as a society. And I'm not doing this alone. I have invited two amazing practitioners who have hands-on experience working in this space, and so they'll be helping us break things down in a way that is simple, um, relatable, and practical. So so before we bring them in, let me just quickly set the tone. When we talk about autism or autism spectrum disorder, we are talking about a development condition that affects how a person communicates, interacts socially, and experiences the world around them. And one key thing I always like to emphasize is that autism is a spectrum, meaning it doesn't look the same for everyone. Some individuals may need a lot of support in their daily lives, while others may be very independent but still experience challenges in certain area. So really, it's really important that we move away from trying to fit autism into a box and instead understand that very individual is different. So, all right, at this point, I would like to bring in our first guest. We have Madam Ruth Praise Emmanuel. Thank you so much for taking the time to join us today. Can you hear me, Madam Ruth?
Yes, I can hear you. Can you hear me?
I can hear you now. So thank you so much, Ma, for joining us today.
Thank you. Thank you
Um,
so much, Loretta.
you're welcome, Ma. So, Miss Ruth Praise, Madam Ruth Praise Emmanuel has over 6 years experience supporting neurodivergent children, including those with attention deficit hyperactivity disorder, autism spectrum disorder, and dyslexia. She uses play and art therapy coaching both children and parents for growth and confidence. So it's really great to have you here, ma'am.
Thank you so much, Loretta.
You're welcome,
Yeah,
ma'am. And now
thank you
I'll
so
also
much.
be bringing in our second guest, Madam Juliana Joseph. We are really glad to have you join this conversation as well.
Thank you for having me.
Can you hear me, Madam Joseph?
Yes, can you hear me?
Welcome, ma'am. So, Madam
Okay.
Juliana Joseph. Yes, I can hear you. Okay, so Madam Juliana Joseph is a special educational needs professional, educational and speech therapist with 6 years experience in behavioral intervention, speech development, and inclusive learning. She empowers children, families, and communities through empathy, expertise, and collaboration. Man, we really appreciate you being here.
You're very welcome. I'm glad to be here.
Same here, ma. All right, ma'am. I have some questions to ask. So, can you hear me? I'll be training some
Yes,
questions, ma'am.
yes, I can.
Yes, ma'am. Training
You
some
can hear.
questions, yes, regarding this. So, my first question, though, is a general questions for the both of you, ma'am. Um, so, to start us from your professional experience, what are some early signs of autism that parents or caregivers should look out for? So,
Okay.
Madam Ruth, what? Okay, Madam.
No, I actually wanted to ask if Ruth would like to take the question, or I should.
It's
Okay,
a
yes.
general question. It's a
It's a
general
general
question.
question. You
Yes,
come
yes.
in.
So anybody can take it.
Okay,
Okay, well,
I'm going to say a few things. Then I don't know if Juliana also have something to say too.
all
So
right.
thank you so much, Loretta, for having me. I also want to thank the I want to thank everyone too for the honor. Thank you so much. The
You're
question you
welcome.
asked, really find autism parents should look out for.
Yes.
Yes, from my experience, some early signs parents should look out for. Uh, Number one, limited or no eye contact. A child
Okay.
with autism spectrum suffered for limited or no eye contact. At the age as early as 12 months to 24 months, that's 1 year to 2 years, you should tell if this child is having a spectrum of autism. With
Okay.
this sign, I'm a new mom, and for 3 months I could know if my child is autistic or not. But the reason why they have a timeline is because that period the child is still very small to take the child. They won't believe you if you take the child to a therapist. She's still small and developing. But at that age, at the age of 1 year to 2 years, the child can communicate very well. So it's you can actually render help to that child. I don't know if you can hear me.
Exactly. Yes, ma, I can hear
Yes.
you exactly.
So, yes. So you should start noticing from 3 months if a child has limited or no eye contact. My child, the baby I have just now, the baby I have, you can notice from
Yes,
three
ma.
months if she has eye contact or not. From that early
You're
stage,
right.
she can maintain eye contact. Yes, another sign you will see is delay
Yes.
in speech. The child will not be able to speak. I don't know if I should continue or let Juliana to speak.
Yes, ma. No, ma.
Okay.
Go on. Go on, ma. You
Yes.
can go on.
Yes. So you see delay in speech or no speech at all. The child will be so quiet. You won't hear the child saying anything. At that age, at the age of 1, 2, you won't hear the child saying anything. And quietness, you find the child very quiet. So these are signs you will see. And also you see the child
Yes,
having a
yes. I've
repeated
seen some. Yeah.
having, having a repeated routine like hand flopping, see the child doing something like this, or maybe rocking and rolling his or her chair like this. These are signs of autism spectrum in a child. Can you hear me? I think I lost Loretta. Hello, can you hear me, Loretta? Hello, Juliana.
Yes, I can hear you. I think she's well, maybe a little bit
Yes,
of a
ma. She's
connection issue
having.
there, but she's here.
Okay,
Yeah.
she's back.
Okay.
All right. So I'm going to add to that. You've actually given us like a good hint of where to start. When you talk about eye contact, a child not having eye contact, autism is something that, like you said, it's a spectrum, right? So it happens different ways, like for different children rather. So for instance, you can have one child that actually gets speech or maybe starts to use words, but some point along the line between 12 to 18 months, they start to lose this speech. So for example, when I consult with some parents, I hear them say things to me like, he was talking. At some point, he was talking, but then it became a speech that we didn't understand. He just kept repeating things that he saw on TV, or he just kept repeating one particular word. So you can have a sign of delayed speech or losing speech at some point. So this is also a sign. And just like she said, you're going to see some behaviors like being obsessed with, staring at one particular thing for a particular time, being obsessed with spinning, flapping, All of these point in that direction. But it's important that you don't draw conclusions on your kids if they experience these behaviors, right? So one thing you're going to see with autism is that these behaviors are very consistent. Okay, it's something that the child does. Loretta, do I still have you?
I think we lost her.
Well, okay, I'll just go on, okay? So, like I was saying, it's something that is very consistent, right? It's not a one-off behavior. So, for example, your child just maybe doesn't maintain eye contact for a period of time, or you were trying to get their attention and you didn't get it, and you are like, okay, I think this child has autism. No, it doesn't work like that. So you have to watch your child over a period of time. Just like Ruth said, from when this child is 3 months, you have to notice the way that they hold your eye contact. Do they smile? Do they show interest? Do they respond to sound, sudden sounds? All of these point in that direction for you. I think another thing we've left out is answering their names,
Yeah.
right? So at some point in between the ages of 3 to 18 months, within this long span, this long time, you get to call your child by their name. At this point, most kids already know that this name is associated with me, right? So this name is my name. Okay, so when you call your child the name repeatedly and they do not answer it, you're calling Stephen, Stephen, Stephen is not even turning. You say the name repeatedly, they don't answer. Sudden sounds happen around them, maybe like a plate dropping or a spoon dropping. They don't turn, especially when maybe they're watching the TV. This is what we call obsessive interest, right? Maybe they're watching some kind of cartoon and then they're just lost. So basically, between um, 3 to 18 months, you get to find out if your child is showing these early signs. So to wrap it up, Praise has talked about eye contact. I've talked about not responding to their names. We've also talked about repeated movements and being
Losing their speech.
obsessive. Yeah, losing speech. Thank you. Losing speech or delayed speech. And I think, I don't know if Ruth agrees with me, but I think as a parent, when you start to see behaviors that your instinct is telling you that something is off,
Right.
right? When you start to see these behaviors that your instinct tells you that something is off as a parent,
Mm.
please get it checked. Don't let anybody tell you no.
No, they'll
Just
agree
get
it. They'll tell you that they are children. They'll
yes.
agree it.
They'll outgrow it. It stops.
That's
Yeah, my
right.
child was doing it. My child also stopped talking. Just get it checked. Okay.
Mm.
All right. So that's all from me on that question. Thank you very much, Loretta.
Thank you so much, Juliana, for throwing more light.
Of course. Okay. I guess we still don't have Loretta, do we?
I think their senses too should be measured at that age too. What do you think about that?
Your
The
senses?
fact of their senses, because most of them don't feel.
Mm-hmm.
Most of them they don't.
Yes, yes,
Yes,
yes.
senses should
That's
be
where.
measured at that age
Can
too.
you all hear me?
Yes,
Yes,
lovely to have you
we
back,
have you
Loretta.
back.
Can you hear me?
I can hear you, but the network is bad.
Oh,
The network is really bad.
Hmm.
it's a situation.
In Nigeria, you are free from that now.
Right?
All right, so
Ah, I can see that joy.
All right. Thank you so much, ma'am, for that wonderful contribution. And though I have seen a lot of people who don't even know what to look out for, from what I've
Mm-hmm.
seen and heard, things like I've seen things like delayed speech, reduced eye contact, like what you just said, and then also also difficulty responding to their name, or even repetitive behaviors can be early indicators. Yes, because I've seen so many people search. So thank you so much, ma, for that. And I feel like the key thing is early observation and early action can make big difference. So thank you so much, ma'am, for Madam Ruth and Madam Juliana for that wonderful contribution. And so my next question goes to Madam Ruth. Why do you think there's still so much misunderstanding or stigma around autism, especially in our communities? Can you hear me, Madam Ruth? Hello. Can you hear me, Madam Ruth? I can't hear you. Can you all hear me?
Her mic is muted.
Can you please unmute your mic, Madam Ruth? Can you unmute your mic?
Uh-huh.
Thank you so much. Technical issues. Sorry. I'm sorry. So your
Okay,
question
no,
is
it's fine.
why
Ma.
is
So
there
I
still
said,
stigma?
why, yeah, there's still so much misunderstanding or stigma around autism, especially in our communities.
Okay. I think is awareness. I think there is misunderstanding in their awareness. That's why we are here to create awareness to them. So people need to be aware of the spectrum autism. Mostly people are not aware of this spectrum, and you see them blaming it on religion or blaming it on spirituality, or mostly they won't blame it on the
It's
doctor
true.
or that. Yes, so they are not aware of it. So I'm going to say a story
Even from
over
them
the
themselves too. Even from the
yes, over
mothers themselves.
yes, over
Sometimes
the
it's,
years,
it's even their
parents I
fault.
work with, mm, parents I work with, they had issues on how to because they don't even know about the spectrum autism. And when they saw those signs, they were actually looking for solutions. And most of them were misleaded. They said that it's a spiritual issue. They taking that child to church, you get. So I think there is lack of awareness mostly. So I don't know if Juliana can throw more light.
Actually, I completely agree with that. The awareness about autism is very poor. It's very low. There's almost no structure around, enlightening the public, enlightening parents. There's something I'm always saying, right? I always say that before you get married, there's something we call counseling that couples go for, right? And usually you spend all the time in this counseling talking about just the
Yes.
both of you and how you're supposed to handle situations between you guys and all of this. But I always wonder at what kind of importance is attached to parental counseling. Okay, because people are almost not prepared for the children that they have.
Exactly.
So there are so many situations that can come up. And when you're not prepared, when you enter into that space of getting ready to have a child with feeling like, oh, bundle of joy, okay, and that's it. If anything doesn't go according to your plan, if you get hit with a surprise package, a surprise bundle of joy, right? Then the next thing, the first thing is blame shifting. Okay, you see, it's the mother's fault, who was drinking, who had a rough past, who annoyed a grandmother in the village.
And
These
she
are the
was caught
questions. Exactly. These are the questions that some persons start
Exactly.
asking.
Yes.
because
And
she
the
did
reality
something
is,
bad in the past.
yes, you see. So they say it's the past that has caught up. And honestly, the problem, what people don't understand, they tend to criticize. This is normal. The important thing is awareness. We need to know that every child is worth your effort. Every child has their own special way that they come. Some are neurotypical, some are neurodivergent. It's just the fact of life. It's not new today. It didn't start today, right? Autism is not something that started today or yesterday. It goes as far back before it was even recognized, right? Before it was like we have this much information. So just like Ruth said, awareness is a huge issue. They don't have the information. Of course, we're going to attach it to something else. So
Yes, ma'am.
if we focus on enlightenment, just like this particular show we are having, talking about it, it becomes something that people understand, that neurodivergent and neurotypical kids are completely naturally occurring. It happens, okay?
Yes.
It happens. And that's why even though there's a lot of talk, for example, I don't know if Ruth has come across this. Some parents will sit in your chair in your office and they will ask you, why me? And at that point, can I ask Miss Ruth, what answer do you give to a parent that asks you, why me?
Why? Madam
Your
Rose, please
microphone is
unmute your
muted.
mic. Please unmute your mic. Hello, Madam. Please unmute your mic. Yes. We still can't hear you. Please unmute your mic.
Is it possible you could do it from your end, Loretta?
No, no,
Just leave it there.
madam.
Oh,
Can
she's
you hear me now?
Let me
unmuted now.
if I can.
Yes.
Okay, yes, yes.
I can actually feel that pain due to the awareness
Mm-hmm.
stuff and the information we have in our own country. Most of the time, it's even as bad as they single them out in most of the things. It's as bad as that. So you can feel the pain. I've reached out to a parent that they looked at her as if she was cursed because she had three children that was all autistic. And she cries
That way
every
not
day.
yes.
Like, yes, as a therapist, like I had to babysit her children and everything. Because it's really very bad in this our country, Nigeria, where there's so much culture, there's so much religion, and
Yes. Well,
yeah,
everything is looked at through the lens of culture and religion, right? And
Yes,
so
exactly.
usually when a parent is like, why me? Like, why does it have to be me? Because this is something that requires more attention, it requires more effort, it requires
patience.
more learning, you understand? So when they ask about this question, I think the best answer is always the fact that there's no why, right? There's no why you, there is no why him. And the
Yes.
important thing is to focus on the child in question. Okay, while we totally understand how you feel as a parent, the challenge that you have with a child that you cannot be sure how to dream about this child. Is he going to be a doctor? Is he going to be a lawyer? When you listen to other parents, you always have these questions. But it's important that when you find out about autism, it's called special for a reason, because it doesn't happen in, so you are special, your child is special, you now belong to a special community. There's almost
Mm,
no why. Okay, there's almost no why. There is only how to help, how to help them
mm,
live with this, how to help them manage, how to help you live with this, how to help you support and manage this. So I think that's
True.
basically it. Just like Shia said, it all has to do with awareness. The more you know, of course, the lesser mistakes you make, the lesser you
mm,
feel sorry about this, the more you're able to handle it with the utmost care. That's all for me.
Thank you so much, Madam Ruth and Madam Juliana, for that wonderful answers. Thank you so much. So,
thank you, Madam.
like you said,
Network again.
It's I can almost feel your frustration from the screen,
okay, the network. Yeah, like I said, like I've seen most
but it's okay.
parents
She'll be
that will
back in a bit.
feel. I've seen most parents that feel
So I've
this
actually had a couple of stories
spiritual.
that are very interesting. Ruth, are you there?
Yes, I'm here. I think
So
Loretta is back.
okay.
Yes, I'm back. I can
Uh,
hear you.
Go
well,
ahead.
while we're waiting for her, anyway,
Mm,
I did have a situation with a parent one time where, as
mm.
soon as she had twin
Network
kids,
is really
and
bad. The network is really bad. The network is bad. And I think it's affecting everyone. Okay,
Can you
so
be
like I would
connected to
say
your
most
Wi-Fi?
most mothers lack awareness and
mm-hmm,
information,
mm-hmm.
and so that
Mm,
is why most of them are just being affected by autism, no children, and but I believe with the information now that you've just given, I believe our viewers have learned so much from it today. So thank you so much, ma. So
Of course.
Madam Ruth, my next question: what are some practical ways families or caregivers can better support individuals living with autism?
okay.
Can you
Thank you
hear me?
so much. Yes,
What
I
are
can
some
hear you.
practical ways?
Practical ways families or individuals should live with autism. I think that everyone, everybody needs to be aware of the child's routine and work with that child. You need to create a very homely environment, a very sweet environment for that child, a very loving environment for that child. Because, like it or not, the child is going through a lot. Having autism as a child is not a
Yeah,
small, is not an easy thing because
most
the
of them
child is
get
taking
bullied also.
yes, and the child can't understand most times, or because there are so many words coming from the teacher or from his or her peers. So
Yeah.
as the mom, you have a therapist, or you should get the child. If the child does not have a therapist, they should get the child a therapist. Very, very important. The child needs to have a therapist and go move on with accepting the child's routine and understanding that the child is not, because most of them they maybe get to have other children that are not special, that are different from this one, and you get to compare or making the child to do that children routine. No, you have to create a routine different for that child that will work for the child very well. So,
Thank you so much, ma.
and
And I think
let's not talk
patience.
about patience. Yes, patience is very
Okay.
important.
Yes,
As a
patience is
mom,
very, very important.
you need to have
Yes,
patience as a mom because
exactly.
we the teachers, we the therapists, we are so patient. So and most time things I've seen back then when I was professionally, you see a child, maybe you are having a lesson with this child, you get to give the child his or her routines, and the child went back goes back home. They don't follow through those routines. They don't follow through the routine. They just let the child do whatever the child wants. Maybe you are trying to potty train that child or having speech with that child, You get to tell
Yeah.
the mom, this is what I'm doing with the child. Or the mom will answer yes, and you go back and the mom is doing, the parent or the guardians are doing different things. So they can't work. They can't. It can't work like that.
You're
I don't
right,
know if
ma.
you
And most
understand me.
importantly, also, I can hear you. And most importantly, also seeking professional guidance early. It also
Yes.
helps, to figure out everything out. Yes,
Yes.
professional guidance too is also important. Thank you so much, Madam Ruth, for that wonderful contribution.
Thank
So, my last question to you, Madam Ruth. From your experience, how important is early diagnosis and what difference does it really make in a child's development?
you. Okay. Can you hear me?
I can hear you. I can hear you.
Okay.
So, I said, from your experience, how important is early diagnosis and what difference does it really make in a child's development?
I can't get that.
Okay. Can you hear me now? Can you hear me? Can you hear me, Madam Ruth?
I don't know if
Can
your
you hear
mic
me
is
now?
mute.
No, it's not muted. Can you hear me, Madam Juliana? Can you hear me?
Yes, I can. Yes, I can.
Okay, so I think it's from your hand, Madam Ruth.
I think it's the network maybe on my end.
Yes, because she said she can hear me. Can you hear me now? Okay, maybe I'll just go over to you, Madam Juliana, and then she'll come back and answer the question.
Answer that question. Okay.
Okay, so, ma'am, I have few questions for you. So, my first question is: as someone working closely in this field, what is one common mistake parents make when they first notice stigma of autism?
Okay. I think when parents notice that their child might have autism, is that the question or the stigma?
It's a stigma, ma'am.
Okay.
No, yes,
So,
ma'am. Like, yes, like the
wh-
sign. Like, what are the signs
okay, okay,
parents make here?
okay. All right. So, I wanted to quickly say that, of course, autism is not a stigma, right? There's no reason for any stigma to be attached to it. We're completely against that. So, if you notice the signs of autism in your child, I think the first thing would be, I'm sorry, I want to make sure that I have the question completely. Say that again, the question.
Okay, I said, as someone working closely in this field, what is one common mistake parents make when they first
Okay,
notice
so
signs of autism? Yes.
the mistake would be, I would say, denial. So, for example, we see this not only with autism. For example, when you go to a doctor, for example, to get diagnosed, and the doctor tells you maybe you have something that you don't want to hear, say the word maybe cancer, HIV, or all of these other, deadly
Yes,
diseases.
like hepatitis.
Exactly, or something like this. Sometimes we hit the professional with God forbid. Okay.
Okay.
Now I want to remind parents that the professional is not speaking a bad word over your child. Okay. And when they give you this diagnosis, they are giving you a roadmap. This is very important to know for a fact what is wrong with your child, right? Or what is going on with your child, rather, not what is wrong, but what is going on with your child. So when you know this, you can move on from there. So I would say denial is the first mistake. The second mistake is waiting. You keep waiting because someone told you my child didn't speak until he was 7 years old. You keep waiting because someone told you that's how they all behave. Some children they do it early, others you just keep waiting. And you know that this is very important time. Medically, a child's brain, the development of a child's brain happens between 0 to 5. So as soon as you give birth to the child, and it's not like that's the entire span of the development, but these are very critical. This is a very critical timeline between that 0 to 5, and this is where we classify early intervention,
Okay.
right? So
Yes.
early intervention is a rock that it's a gold mine. If you strike early intervention for your child, you've changed the whole story. You've changed it from how bad it could get, or how out of control it could get, or how mismanaged it could get, to under control, to under correctly managed. So denial, waiting, and then finally, please avoid Google. I beg you
Exactly.
in
Because many people get their answers from Google, and sometimes it brings out wrong
avoid
answer.
avoid this guy because it's going to scare you. It's going to tell
Yeah.
you, oh, it's not because at the end of the day, you're digging information from a lot of sources, right?
Different.
You're getting it
Exactly.
from research that is not concluded. You're getting it from someone that just typed on Wikipedia, or you're getting it from exactly because Google is like an archive of a lot of information.
Information.
So when you
Yes.
take this and you judge your child by it, you only fall deeper into fear. So please
Okay.
just ditch this. Ditch the denial, ditch the waiting, ditch the googling for answers. Just throw away these steps, throw away blaming, right? And find a specialist.
Okay.
Find a specialist, okay?
Exactly.
Find
Because I
a
think some people that
pediatrician.
think that that always makes us different profession
Exactly.
from different people
Find
that are not even professional. Yes.
and yes, that's something we also see. You can go I want to say this, right? Before I hand it over back to Ruth. Um Please, if you get a first opinion, right? You get a first opinion and the person says nothing's wrong with your child now. Didn't he just say hello? I beg you in God's name, seek a second opinion. Seek a second,
Okay.
seek a third opinion. Don't worry, it's not that you are looking for trouble, you are just making sure. And the best time to make sure is the early
Early
years of
stage.
your child's life. This is your best
Yes.
bet. Okay, so just seek a second, seek a third opinion. I've had a lot of these cases where the doctor said there's nothing wrong. Okay, and finally, when we were together, I was able to work with this child. I was able to get an assessment. Always remember assessment. Like keep this word in your dictionary. Assessment. If they are not assessing your child and they are telling you nothing is wrong, then something is really wrong. Okay. So
Okay.
an
All right.
assessment must happen. An assessment must happen. You must get the report of an assessment,
Okay.
okay, and under every stage. And this assessment must be compared to generally accepted milestones, generally expected milestones. So this is the right way to go. Avoid these mistakes. Don't deny, don't wait, don't go to Google. Get a specialist. Okay? Thank you. All right, over to you, Ruth.
Thank you, Rihanna. Okay. Okay, mom. All right, over to you, Madam Rose. I asked a question, but you didn't get me. I
Okay.
said, from your experience, how important is early diagnosis and what difference does it really make in a child development? That was the
Okay.
question I asked.
Early intervention. That's early intervention, right? Is really very
Yes.
important. It's
Yes.
very, very important. It builds communications early and social skills early. And it also makes the work for the child and for the mom to be easy. It helps the mom to know his or her child better and helps the child to also understand his or her routines better. So that's why we have early interventions. It's very, very important.
Yes,
Like
ma'am.
Juliana said before, she was talking about a child's brain, how it's been built and everything. So if
Mm-hmm.
you start, like I said before, at the age of 1 to 2 years,
0 to 5.
0 to 5, and I said at the age of 1 to 3 years, you discover that this child is having a spectrum, an autism spectrum, and you start doing something about it. You will see because they outgrow it. They outgrown it. I've dealt with children which have the parents discover this early diagnosis earlier and they reach out to a specialist for assessment. We assess this child and we discover that these things was really noticeable. This child was an autistic child. But do you know that this child is doing very well now? He can communicate very well. He has eye contact. He had grown it because there was early intervention. So it's very,
Yes,
very
ma'am.
important.
Yeah,
It's very, very
exactly.
important.
You're right. You're right. Honestly, because I've seen how much of a difference it makes when a child is diagnosed early. I also um, I also knew someone that has a child that was diagnosed with autism, but thank God they were able to get to notice it on time, and so they got the necessary information that they
Mm,
needed, and the child is better now.
mm,
At least she can speak a little. She's getting better. Like you said, like she's having that eye contact. So
yeah.
it's very, very, very
This
important.
Yeah.
Yes,
person I'm talking about,
it's very
the guy,
important that parents
the
should pay
this,
attention to their children, because not everybody
yes,
really pays attention to their children.
yes.
Yeah.
Yes.
I
That's
think to close this up, right? Just like Ruth was saying, or like just to add to it anyway. Um, I think we should understand that when it comes to autism, autism is not necessarily something that gets fixed, okay? And it's not
Yes.
something that goes away. Honestly, I sometimes tell people that I may be autistic actually. Mm.
Okay.
Well, yeah, I may be autistic. I may have hyperactivity disorder. I may have an attention deficit as an adult, right? Maybe I'm just on a spectrum that makes it not so noticeable. Or, but even more importantly, I have grown techniques that help me manage it. So, as adults, generally, we can have ADHD, we can have an attention deficit. Like, I can be doing one thing, right? And my attention goes to the other, like within minutes. My attention runs back and forth, right? So,
Yes.
but why do we use notes? Why do we use sticky notes? If you look at that wardrobe behind me,
Yes.
right,
I can see.
you see
Yeah.
some stickers.
Yes. I can see
Yeah,
that.
sometimes they are for decoration, other times they are to remind me. Okay. And I know I know sometimes some people I know that have a whole their whole cupboard is full of stickers. And I'm like, what's
Even
going
their
on?
fridge. Even their fridge. The walls.
Everything is full
Everywhere.
of why? Because but there are other people that don't forget. They don't need the stickers and they also don't forget. Right? So the
Yes.
entire idea is when you start from that early age, you're able to help the child develop techniques that manage everything that they deal with as an autistic child.
Exactly.
Okay? So at the end of the day, it might even become something that no one can tell that this child was is actually autistic.
That's what
Autism.
I'm
Yes.
talking about. That the child gets
Exactly.
to
Exactly. So you see them reading, you see them holding conversations, but it wasn't
mhm,
always like that. Early
like that.
intervention Early intervention help. So I don't want our viewers or people listening to think that this is something that you make disappear. No, no, no. You're building around it to make sure that this child lives an independent life. Okay? You can even work with autism itself. Like you can work with it to make sure that the child lives an independent life. So
Yes.
sometimes you see some children on the spectrum, they're very good at one thing and they're very bad at the other.
Right. Yes.
So what do? You completely cancel out the other. Focus on that strength and make it big. Make it so big that it covers for that weakness. Okay? And just especially to help them live an independent life.
Thank you so much, Madam Juliana. All right, my next question goes to you, Madam Juliana. What
Wow.
kind of therapies or what kind of therapies or interventions have you seen to be most effective over the time, like over time? Yeah. What kind of therapies or
Okay.
interventions have you seen to be most effective over time?
Well, there is one that is very that is effective and it is also very popular. Of course, applied behavior analysis, right? ABA.
Okay.
So basically, ABA is it's lovely, it's effective, but I think one of the biggest weakness of this therapy is the fact that it only happens in a controlled setting.
Okay.
All right, it's only very effective in a controlled setting. So, for instance, I was working with a child one time, and this child said their first word in my office, like after a while. And on that day, I was working with the child in a controlled setting, right? And I had told the
Okay.
parents beforehand that when the child says a word, don't over celebrate it. You scare him, okay? Because
Okay.
he has to understand that this is a normal, this is
The
a
normal
normal way of interaction.
process.
Exactly.
Yeah.
So he doesn't feel like he's doing something that puts attention on him because he doesn't like the attention. So
Okay.
on this particular day, the child said a word to me. He said bye, right? This is the first one we've had in a long while. Like the first situation appropriate word. Like he was actually leaving and he said goodbye. Right? And at that point, I could see the excitement in this parent. She really, like, she wanted to say, but she remembered what I told her, and she was like, "Good job," and that was it. So, that is ABA for you. ABA is very dependent on controlled setting. Everybody has to follow the script. Okay, one
Yes.
person breaking the script can be a problem. So ABA is very effective, and I think a powerhouse is speech therapy. The reason I say speech therapy is a powerhouse is because speech therapy has aspects to it. It engages play, and play is very natural to children.
Yes. Yes.
Once they feel like it's a class, it's a study, it's work. Honestly, you've lost that child before the class even started. You've lost that child before that session even started. So
Yes.
when they know that it's actually like play, it happens naturally to them, for them. It occurs naturally for them. So when you pair speech therapy with when you pair
Behavior.
speech therapy with ABA, you're doing wonders. You're doing wonders for this kid, and you will definitely see results.
Result.
So I think other therapies are always welcome. You see, occupational therapy, yes,
Even
but
behavioral therapy too.
yes,
Behavioral
actually,
therapy.
that's what ABA is about.
That's
ABA is actually about behavior. Yes, ABA is
Okay.
behavioral therapy. So when you're pairing ABA, speech therapy, and occupational therapy, especially to build those kinetics, because something you will find that is common with autistic children, you
they're
can be
very
telling them the verb, you can be telling them the verb, and they don't even understand what you're asking them to do,
Yes.
right? So you can tell them kick the ball, for
Okay.
example, and he's hearing you say kick the ball, and you're like kick the ball, and he doesn't know what the word kick
I think you
is.
have to demonstrate it, right? At least it will help
You
them. I
have to
think
demonstrate,
to
and
demonstrate.
sometimes give them an idea of sense, like a sense of self. I
Oh,
have found myself at one point raising the child's leg to kick, right? I have found myself holding the child and doing it with him, kicking the ball. And as soon as the child got it, oh my goodness.
the
It was like
excitement. They're so
every
happy.
yeah, I want to play ball. I want to play ball. I want to play ball. And he's kicking it all over the place, right? So it just
Exactly.
needed that connect, the action and the word. The action and the word. So yes, behavioral therapy, occupational therapy, this falls under occupational therapy, action and word, right? So occupational therapy and speech therapy, you need to hold on to those guys.
All right.
All
Thank you so
right.
much, Madam
You're
Juliana.
welcome.
Madam Ruth, I don't know if you want to say anything regarding this.
I think she said all already.
Okay. All right.
She
All right. Thank you
mentioned
so much.
those three are the basics, and she mentioned it already.
All right. All right. No problem. So, Madam Juliana, my next question, that is the last question.
Wow.
What would you say to a parent who just received an autism diagnosis for their child and it's feeling, and is feeling overwhelmed?
Yeah. Okay. I think it's very natural that you feel the way you do. It's not
Okay.
if a parent feels overwhelmed, it's not out of the ordinary, because when you're told, of course, that your child has autism, I'm going to tell you some things that are very real, right? The first
Yeah.
thing is that your child is different. Okay, he's not
Exactly.
he's not neurotypical. He's neurodivergent, and with this comes a different set of responsibilities. It looks difficult because it is different. Okay, and honestly, when it comes to a child will always require effort, whether the
Exactly.
child is typical or divergent. But when the kind of effort you're putting in for your own child is not the type that you can relate with all other parents, then you feel like yours is difficult. But that is not the
Yes.
case. Yours is just different. Okay?
Yeah.
So the first thing I would say is calm down. Just breathe. You're just in a different sphere. So the second thing is you don't need to look at your child differently. He's not a curse, he's not a problem, he's not a nemesis. Please don't ever.
I've seen some that abandon their child. I've seen some that throw
Yes,
away their child just like
yes, we've had this
And
situation.
they poison the
It's not a
child.
nemesis. He's not a reminder that he's not a reminder that God forgot you. He's not a reminder that God hates you. No. Okay? He's just a different child. And that's okay. Now, you might want to reach out, find parents within this sphere, parents who share the
Mommy,
same
mommy,
the same what's it called,
like
parents who
um
exactly, who are in the same
is it the same
community,
thing that that the other parents, okay, yeah, just like they have the
exactly, who
same
are in
issue.
the same
Yeah.
community, exactly. They are your best bet, because I'm not saying that you should exclude your child. Please don't do this. Please don't isolate your child. Please don't isolate yourself. Okay? Have a
Okay.
pride in your child's difference. It's not easy to be different. It's, in fact, I think it's like it requires more responsibility, it requires more attention, but it's just different.
Mm,
So you want to reach out, find communities, join their WhatsApp group, join the Telegram group, find out
exactly.
what's going on. Exactly. And these
Yes,
people are going to be
exactly.
the ones to give you referrals. They're going to tell you about schools, okay?
Exactly.
They're going to tell you about schools that have a special education unit. That's a topic for another day, because
that day.
one of my recent anger has been that there are still a lot of schools in Nigeria where their
That still
kindergarten,
accept such children. I've seen that too. They
now
still
it's
accept
not,
such children.
Yes,
yeah, schools accept such children, of course,
So
and
like I
yes,
mean the normal, like where the normal students are, and they still accept
yeah,
yes, of
yeah,
course,
such
it's
children,
good.
and
It's
it's not
good.
supposed to be so. It's not supposed to be
not
so,
not
No, 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 no.
I think
We don't
Ruth,
have, we don't have
right?
issues. Sorry, can I say something?
I have issues
We
with
don't have
Okay.
issues
that at all.
with them accepting those children. They are
No,
not different. They are still humans. The only
exactly.
issue we have
Okay.
with them is that they don't do something about those children.
Exactly,
We don't do
exactly. Thank
something
you so
about
much.
them. They
Thank
have to
you
have
so
their
much.
own world and
Please
bring them back. Really.
let's set that aspect straight, okay? There are a
Okay.
lot of
Okay.
settings. There are a lot of settings that you can find special kids, right? You can find them in a special school. You can find
Okay.
them in a typical school, but that typical
Normal.
Okay.
school must have a special needs department,
Special need.
a
Thank you.
department
Okay.
that cares and caters to the learning of the special children within the typical school. You
Okay.
cannot just put them there and leave them there. Okay,
All
it
right.
doesn't help any
Okay.
situation. And please, I think that what you just said comes from one of the new, will I say, stereotypes, that when a special child is around typical kids, then it is a disadvantage to typical kids. That is not true. That is not true. It is actually a
Okay.
huge advantage to the special child, and
Yes, because
at no
they
cost
learn
to
their
the
behavior.
typical kid. Okay, especially when there is a department that controls their integration, that controls their being around typical kids. So
Yeah.
I think with that said, that is the only concern that I have. You can't have a school. In fact, every school, that is one fact that Nigeria misses out a lot on. Every school, especially if you have
Exactly.
a daycare, if you have a kindergarten, if you have children between the ages of 2 to 5 in your school, you should employ the services of a special needs consultant. You should have the phone number of a speech therapist. Yes, you should have them coming in. You should have them checking out, because you should have them checking in, because if the parents don't notice this, maybe because they are very busy, right? Maybe because they are very busy, then the school is a
Yes.
go-to. The school should be able to call the parents' attention and say, "Oh, your child is not maintaining eye contact in class. He's not socializing. He's not saying any new words." Because whether we like it or not, there are
Yeah.
parents that are very busy.
Exactly.
They drop their child in the morning and pick them up at
Yes.
night,
Yes.
and they pay
Or
you in
some they
Yep.
know.
Yep. At night.
Some they know.
Yes.
They just want to know if the school is effective. They just come and drop their specialty and tell you that everything is okay. So you do your own work as
Yeah, so I think this is huge. This is huge because
Exactly.
when you check the school systems outside of
Exactly.
Nigeria, it's not necessarily done. It's not done that you have a kindergarten and there is no special needs like contact. In fact, there are some schools that run only kindergartens, and there is no special contact, special needs consultant. There's no therapist contact. Nothing. Nobody's on speed dial. They just bring the child in, send the child home, and then at the point where the child is entering into primary, nursery 1, nursery 2, the teacher is having a headache because even the teacher cannot understand.
what's going on.
The network is interrupting.
Yes, so I was saying at the point where the child is now apparently, or in quotes, school ready, they're taking the child to
Okay.
nursery. The teachers in that nursery school are now confused. They don't know what's going on. They don't understand why the child is not talking. And these are situations that the
Exactly.
kindergarten was supposed to raise, right? So
Yes.
that's aside. If you're just finding out your child has special needs, please reach out to the school, to the community. This is one of your largest checklists. Just reach out to the community and make sure that you're not alone. And diagnosis is a roadmap. It tells you, I've had a situation, right? Let me just give for instance. Um, I had a friend back then. She was ill. She was sick, and we went to the doctors, and the doctor said they don't know what's wrong with her. This is the first heart attack, right? And like when you're ill, you
Yes.
can see the person is sick, but the doctors don't know what is happening. So if
Mm-hmm.
you go to the doctor and the doctor says it's malaria, you have a peace of mind that
And you
at
can
least
just
I know
Exactly.
what's wrong. And because of this, I can go
Yes.
and buy Lumatem or Amatem.
Malaria
I
drug.
know what
Yes.
I even know what to buy. And I am sure that in 3 days, God willing, I should be fine. But if you don't know what's wrong, where do you even start? This will
That
have
is
you
it.
going from doctor to doctor. So if you are
To
told
doctor.
that your
Yes.
child has autism, it is a blessing that you can, there are structures in place, there are interventions in place, there are people out there to help you learn how to manage this, learn how to support this child. Anytime a doctor or a specialist tells you your child is on the autistic spectrum, please, no matter how overwhelmed you feel, don't make the mistakes that I mentioned earlier. Okay, reach out to community and please get intervention. Get intervention. It's just like getting drugs for your malaria. Okay, because you know that you will be fine and this child will be fine. So thank you very much.
Thank you so much. Thank you so much. And I also love to tell all mothers watching that they should all pay full attention to their children. They should understand their child's well-being. They should understand their child very well, and also talk to people, to professionals, to support, so that they can get the right support and in the right way. So thank you so much, Madam Juliana and Madam Ruth. Thank you so
Thank you
much,
so
ma'am.
much,
You're very
Okay,
moderator.
welcome. Thank
so
you.
yeah, so at this point, I would also like to hear from those watching. If you have any questions, experiences, or even sometime maybe or something you've learned today, feel free to drop it in the comments. So we'll try to respond to as many as we can. Okay, so far there's no comments. Okay, Madam Juliana, Madam Ruth, I don't know if there's anything you love to say with our viewers. I don't know before we end this. I don't know if there's anything you would love to say.
Okay,
So, Madam
I
Ruth, it's up to you, ma'am. I don't know if there's anything you would love to say.
Okay,
No, she
thank
can hear
you,
me.
Madam Director. Can you hear me?
I can hear you now.
Can you hear me? Okay, thank you so much, Madam Director. Thank you so much. Yeah,
Thank you, ma'am.
I think we need to go and we need to keep doing this. We need to make the world know that awareness is key. Awareness for disorders and awareness for autism spectrum need to be it needs to be all over the world that people can reach out to, because it's a big issue that parents get to give birth to children like this and they are confused and they don't know how to start. Most the most parents I I met, they have issues on how to get professionals, on how to even know what is even wrong with the child. They take the child to hospital, and Nigeria hospital, they keep saying the child is sick and the child is not sick, just because the child is having a spectrum, an autism spectrum. So this awareness needs to be created. People need to get to know about it. I don't know if you are hearing me.
I can hear you.
People need to know about this.
I can hear you.
Yes, people need to get to know about it.
Okay, thank you so much, Madam Ruth. So, Madam Juliana, is there anything you'd love
well,
to say?
yeah, I think it's just as Ruth has said, awareness is very important, and that's what this day
Yes,
is about in itself. Like the whole month of April has this autism about it. Of course, there are other cases and other months, but I think in the case of autism, awareness is not just the responsibility of parents with autism. You know, if a parent who has an autistic child has to be tasked with telling people about autism and stuff like that, of course it's okay. Be your child's advocate. It's very important. We too are advocates, right? We are therapists and we are advocates for these children. But it is not just the responsibility of the community to advocate. When you know about it, tell somebody about it. Information is not wasted. It's not something that you only use,
You
like
just
you
keep
only
to
collect what
yourself.
you use.
Mm, yeah.
It's not something you collect only, like you only collect information that you use. No. Sometimes we read random articles. For what reason? So that you can know in case you meet it, okay? In case you meet a child along the way and you can say, oh, this child may be autistic. Let me give him some grace, right? So this is why awareness is important. It's not just the responsibility of people within the community, but please, if you know about autism, in this autism month, tell somebody about it. Talk about it, okay? And hopefully in we will see more enlightened days. Thank you very much.
Thank you so much. Thank you so much, Madam Ruth. Thank you so much, Madam Juliana, for this wonderful conversation. I
Thank you.
really, really learned a lot. So, as we wrap up, I just want to
Did
say this
you?
has been a really meaningful conversation. Personally, I've learned a lot, and I'm sure everyone watching too has picked up something valuable
Somebody's
as
about
well.
to join in to ask that question. She has been trying to click in the link. I don't know.
Oh,
No, she can join. She can join live.
oh,
Okay.
she can
Yeah,
join
she
the
can
live,
join.
but she can make a comment, right?
Yes, yes, she can make comments.
Okay. Okay.
So she
So,
just has to go through YouTube or make a comment here. Oh,
Network.
there's any one thing I
yeah,
would
I
just
think
Tell me your story. You want? There's one story you want to share.
you wanna
oh,
hear my story?
Really?
No, actually, there was one time you were not on, and I was trying to talk about parents that had twin babies, and
Hmm.
both of them were autistic, right?
yeah.
And she told me about a time when her relatives showed up to the house unannounced, and they started anointing it with
Hmm.
With anointing
with
oil,
oil
you will see
and
some
water.
even pouring water
Bringing the
everywhere.
demons.
Yes, to send away, And she was like in so much shock that day. Of course, speaking about it now, and even then, it's definitely not a funny situation, and it is not fair. I
Hmm.
also personally know a lot of marriages that have suffered because of
Hmm.
this, and
Yes,
it's like I said in the beginning. There's a lot of relationship counseling, marriage counseling. I have never heard of parental counseling, pre-parental
Parental
counseling.
control.
This exactly. We
I think
need
that's where
we need
autism,
this
awareness of autism will get to come in.
yes,
this way
Can you
every
hear?
parent knows. Yeah, I hear you, Ruth. Just like you said. This way every parent knows before they even encounter it, if they encounter it. So pre-parental counseling, parental counseling. Let's try to start advocating for that as
Hmm.
well. Let's talk about this. So that you don't just
exactly,
go into having children blindfolded. Okay? Let's know
exactly.
what
Hmm.
are the possibilities
Yes, you're right.
and
Like I
what
said,
should you do if they are. Mhm.
exactly. I don't know if anyone has dropped any comments, because from my hand, I'm not seeing any.
Ruth, maybe she could pass you the question if you have
Okay, ma. Okay, I can. Okay, ma'am, you can just answer the question. Maybe you can just say the question out, and then you can answer.
Question.
So, what is the question, Madam Ruth? Can you hear me, Madam Ruth?
Yes, she hasn't sent it yet.
Okay. All right. So,
She's trying.
like I
She's
said,
trying to send it.
Okay,
okay.
okay.
All right. Before she's saying it, so like I said, personally, I've learned a lot today, and I'm sure everyone watching also has also picked something important too as well. So, if there's one thing I would like us to take away from today is that autism is not something for fear or misunderstanding. It's something to understand, accept, and support. So let's try to be more patient, more informed, and more inclusive in how we interact with others in our daily lives. So I want to say a big thank you to our amazing guests for sharing their knowledge and experiences. It truly means a lot. And to everyone who joined, thank you for your time and attention. Please don't forget to share this section so more people can learn. And don't forget to like, to comment, and subscribe to this channel. So we'll definitely be having more conversations like this. So, Madam Ruth, has she sent a question? She
Not
haven't.
yet.
Okay, so possibly she can still send it even after this section and we'll attend to
Mm-hmm.
her. Yeah. So thank you so much, Madam Ruth. Thank you so much, Madam Juliana.
Thank you so
Thank you
much,
so much
Madam.
for this wonderful
You're welcome. Thank you.
conversation.
Yes.
Yes, ma'am. So
To
do
the
have a
organizers,
wonderful.
thank you so much.
Yes,
Thank
we
you.
really appreciate this effort. It's lovely for us to be able to talk about this on here, and we hope to see more.
Mm.
It's you will, ma. You will. Thank you. Do have a
Of
wonderful
course.
evening. Thank
You
you.
too. Thank you so much.
All right. Bye.
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 Miss Ruth? Bye.
Yes.
Ma, you
Uh,
want to say something?
No, I was
no.
actually saying my
Okay.
personal bye.
Bye.
All right, ma'am. All right.
She's asked
Goodbye.
me it's over.
All right. Bye for now.
Bye. Are you saying bye too?